Delirium raises an issue right across the spectrum of cancer treatment. Anyone who's acutely unwell is at much greater risk of being acutely confused. Certainly late in life we see this more frequently, but all people being treated for cancer or living with cancer are at greater risk than the population at large. I think we need to have a high index of suspicion when people's cognition has changed. The majority of people with cancer will have a hyperactive delirium, but the person sitting quietly in their bed may well have a hypoactive delirium. We need to have an index of suspicion in order to recognise it, and having recognised it, we need to look for reversible causes. This is an incredibly disturbing issue for patients because the majority of patients, as they clear their delirium, have vivid recollection of their delirium, including the hallucinations. So we need to look at the list of things that we can reverse. Infections, metabolic changes, the drugs that people are already on that may need to be adjusted as a result of their cancer or its treatment. We need to be active in looking for these things so that we can provide good support for people in this frightening experience. We see lots of people with delirium who have reversible causes. I think the most obvious would be a urinary tract infection in someone who is having chemotherapy and became somewhat neutropenic. The challenge is recognising it early, treating it aggressively so that we're supporting people, making sure that the environment in which we nurse that person is supportive. That is, that we look at day and night, we ensure that that is a high priority, we orient the person, we provide a safe environment for them because if they are hallucinating, those hallucinations are very real and we need to ensure that we're minimising any potential harm to that person. The bottom line for delirium is have an index of suspicion, think about the very sick patient, they're at high risk of delirium, and that delirium will not only cause problems while they experience it, but the majority of people are going to remember it afterwards, and it's a frightening experience with a reality that's really quite overwhelming.